think Cindy's muted. Are you trying to say something, Cindy?
I'm sorry, I'm trying to work on the video part to stream. The normal staff that's on the dais, that'd be okay. Fine.
My screen still shows me when I move down like this. I take this off of the bigger screen and you can still see. Right.
That's fine for now.
But if I remove this and I take this down and I want to look to my notes, it doesn't take me off, right? It still shows me as a video.
Yeah, what you have to actually physically hide your self view. Just turning off the video doesn't do that.
But it'll still stream and look at me, right? Which is what I would want if I'm doing an update.
Yeah, so you definitely want to have your video on and unmuted. Yes, that's correct.
Okay. Hello, Councilmember Koberstein and Councilmember Chateau.
Hello.
Mayor Ellsworth.
Hey there. I want you to know I have a Zoom meeting tomorrow, and we have 3 different links because we have a closed session, an open session, and a closed interview session. So it's pretty amazing the way people are putting this stuff together.
That's a lot of logistics behind the scenes.
Yeah, definitely.
Priya?
Yeah.
If somebody from the public wants to watch this meeting, what is the link that they would go to?
Great question. So they can just open up our agenda and they can follow the link on the agenda for Zoom. It's at the very top, but we're also streaming this on channel 28. So Cindy, I don't know if you have anything else you want to add.
So people who love to watch us at home can just tune into their normal TV and watch us. Yeah.
So fantastic. I just confirmed we are live streaming. We're going to be broadcasting on channel 28 shortly. And Priya and I practiced this afternoon, and I think this is going to be very successful for us.
Good. We didn't have active vintage.
And I currently have no members of the public who have joined via the Zoom meeting. So I'm just sharing that.
Okay.
And just a reminder to make sure mute yourself if you're not speaking.
Okay, where do I do that? Just down below in the far left, right? Okay.
Hi, Paul. Hi, David.
How you doing?
Good.
Hey guys.
Hi, we see you.
Yay.
All right.
Do you want to see me, or should I just go back to my picture, which is
I want to see you.
It's a better version of myself.
It's great to see you.
Okay. Good job, Priya and Cindy, for making this happen, by the way.
And our entire planning section led by Maya.
Oh, yeah, can't forget that.
Thank you all.
So why do we see Cindy 3 times or her name multiple times?
I don't know.
Probably she's probably calling in as well as video. So she's probably doing call in through her audio through her phone.
So we have an interesting setup down at the boardroom. I've got multiple laptops in order for this to work correctly. So that's why.
Thank you.
Hi, it's Karen Reluccio. Okay.
Hi, Karen. It's Anna. Thank you so much for taking time to come and speak with us today.
You're welcome. You know, I cannot turn on my video camera for some reason. So, won't let me.
That's okay. We know your voice well now.
Okay, good.
So our plan today is that we're going to open the meeting and go right to you, Dr. Reluccio, because we know that you have limited time.
Perfect. Thanks.
Will we
Thank you.
see who, if we have public, sorry, it's David Knutson here, Dr. Reluccio, will we know who, if there are public comments and will they be, how will that work?
I think Priya or Cindy will know.
Priya is our moderator. So Priya will be monitoring all public comment and watching as people come into the meeting.
Yes, ma'am. Thank you so much for allowing me to help with this. I am sort of the behind the scenes, but Cindy is clerking the meeting. So thank you, Cindy. And thank you, everyone, for your patience today. I really appreciate it.
So, David, just so you know that what's going to happen here, we'll do presentations by Dr. Reluccio and Dr. Herber from the hospital, and then Priya will go over briefly the protocol for public comment and participation. So we will make that available in the meeting for the public to hear.
Control.
When do you hit record, or are you already recording?
The meeting is already being streamed live
Oh, great.
and recording.
Fantastic. Excellent. That's great. On our website, on the city website.
That is correct. And on channel 28. And we have 2 more minutes and we'll start the meeting.
I'll wait for your cue, Cindy, when you're ready to go. Okay. I'd like to welcome everybody to the City of St. Helena Special City Council meeting, Tuesday, April 7th, 2020. I want to thank everybody for the continued focus and calm through this challenging time. We're going to do our roll call and then move right into a presentation by Dr. Relucio from Napa County Health. So we will start with the roll call.
Mayor Ellsworth,
Here.
Vice Mayor Doring,
Here.
Councilmember Chateau,
Here.
Knudsen,
Present.
Oberstein.
Here.
Okay, very good. And now I will hand this off to Dr. Relucio, who I believe has 15 minutes with us today.
Good afternoon. So just to start off with what's going on in Napa County, we have 23 cases and 2 deaths. And in California, the cumulative there are over 16,000 cases and over 380 deaths. Across the United States, there are 378,000 cases and over 11,000 deaths. And worldwide, there is now 1.38 million and 76,000 deaths. Right now, we are actively following 14 cases, and we've had a cumulative of 24 cases. And then we are following 83 contacts actively, and we've had 106 cumulative contacts to cases. Most of our cases have been in the city of Napa, followed by 1 case each in American Canyon, Calistoga, St. Helena, and then 4 in other unincorporated areas, mainly a couple outside of St. Helena and a couple outside of the city of Napa. So in terms of testing, we've had 493 tests conducted across the county, with 175 done in public health and the rest of them done outside of and other healthcare systems. So far, we have 349 negative tests, 121 pending tests, and 23 positive tests. In terms of outbreaks, we have mostly had influenza outbreaks and outbreaks from a respiratory syncytial virus. And we've had 1 respiratory outbreak of unknown etiology. So any outbreaks that we know of unknown etiology, we're aggressively trying to identify and do COVID-19 testing for that. In terms of our influenza-like illness daily poll and in the emergency departments, we've actually we're actually below the yearly average of what we see, but part of it is that some of the volumes in the emergency departments are a bit lower. And then in terms of just other activity that we've been engaging in, we're continuing our case and contact investigation. And one of the areas that we really try to do is to isolate identified cases by issuing isolation order, which is a legal order. And then we do quarantine order for close contacts of cases. And that's also a legal order. In addition, we follow any contacts that are medium to low risk. So high risk contacts get a quarantine order. Medium risk contacts are put under self quarantine with public health monitoring, which means we contact them, throughout their 14-day potentially infectious period, and we do symptom screening. If any of them end up having symptoms, then we test them to see if they are positive for COVID-19, and we put them under an isolation protocol. The second activity that we've been doing, aside from case and contact investigation, is planning for healthcare surge. So we've been working with our hospitals and residential care facilities, as well as planning for an alternate care site. So our hospitals have the ability to surge, together to up to 350 beds and can surge to 32 ICU beds and so far have 39 ventilators, but I know that there are attempts to increase that by resource requesting. But in addition to that, our other goal is to take the residential care facilities, skilled nursing facilities, long-term care facilities, and other congregate settings, and ensure that they're able to retain their COVID-19 cases and put them in isolation, and to have an infection control plan to prevent outbreaks in those facilities. So we've been in close contact with them, and on March 11th, I had issued a health officer order for these skilled nursing facilities or these residential facilities to ensure that, number one, they don't allow non-essential visitation. So the only circumstance where visitation is allowed is if the resident within that facility is terminal. So that is considered essential, but otherwise we're trying to restrict visitation, and then all staff are required to do temperature and symptom monitoring to ensure that there's no staff that transmit it to residents. And we also required a COVID-19 plan. So this COVID-19 plan is a way to ensure that they have an infection control area, a plan to isolate people that might have influenza-like illness, and to try to get them tested and to report any outbreaks to us. I think that most of these facilities have turned in a plan, but we have a physician that's actually evaluating each plan. If there's defects in those plans, then they have to submit another one to us. We are now going to have volunteers reach out to them and to really walk through how they're implementing these plans. The other part of this is that we are working on our own alternate care sites. So so the one way that we decompress hospitals is, first of all, hospitals have to have a plan to surge within the hospital. So that means canceling all elective surgeries, repurposing areas of their hospital to be a COVID-19 unit, finding other parts of their hospitals that they could use to have more to withstand the surge of patients that go into there, and then the other part is finding a way to decompress the hospital from people that are lower acuity. So there's a couple of plans for that. One that we're doing is trying to work on alternate care sites. And I know St. Helena Hospital has identified a site. We have identified another site in Napa in conjunction, in collaboration with Queen of the Valley. So we're identifying a couple of sites where lower level acuity patients could be put there to have the rest of their hospital stay. And the other option is increasing home hospital or home care options for people that are lower acuity. So that's so I just talked about the healthcare surge side. The third thing, of course, is our social distancing strategies. So this is the shelter at home order. That was a new order that was more restrictive, was enacted on Friday, April 3rd. And the difference between this order and the previous order is that all essential businesses have to have a COVID-19 social distancing. In addition, we also restricted some activities in outdoor spaces, such as, places for congregations, such as, playgrounds, basketball courts, golfing, tennis, any opportunities where people could possibly get contaminated with COVID-19. So that's another thing that's different. And the third one was narrowing down what's considered to be an essential business. So that was, so just making sure that those essential businesses are doing the minimum basic operations in order to promote social distancing. So those are the three big differences between our previous shelter at home plan and the current one. And this is going to last until April 30th, and then we will reevaluate the need to have a restrictive plan. So the The fourth thing that we're doing is we're continuing to do our testing sites. So we have a drive-through specimen collection site, which is located in South Napa. We're collecting specimens and submitting them to our public health lab, but we have certain criteria in which we're able to do that. First of all, it has to be someone that's part of a congregate facility where there's a risk of outbreak. The second thing is that they're a healthcare worker or a first responder or somebody that has close contact with cases where we're trying to make sure that we don't lose that workforce to being isolated or quarantined because, we need to find out they're COVID positive so we can determine what kind of actions are taken. We want to try to maintain our workforce if we can. And so they are considered higher priority. And of course, people that are hospitalized. But I think as our healthcare facilities are ramping up testing in their own facilities, we're finding that we're no longer going to need to use our public health lab tests to test the hospitalized patients as that ramps up. So we're also exploring a mobile testing option. So there are people that just cannot drive to our site, and they may be in farm worker centers. They may, be part of a skilled nursing facility. So we're trying to find staffing for a mobile testing team that can go out to sites. At this point, this is the end of my presentation. If there's any questions.
Thank you, Dr. Relucio. Are there any questions from council?
I have a few questions. Paul Doring.
Yes.
Yes.
Can I go? Okay.
Yes.
I have 3 questions. Maybe I'll just ask them all and you can take notes and then go through them. These are the notes I was thinking about today. One of the things is do you have any thoughts about the use of masks by asymptomatic folks, the making of masks at home, and then the delivery of masks by people? People are doing good work and very charitable, but I'm concerned about the protocols that we have in place in Napa County. So if you can address that, that would be great. I'm wondering if there's any promise of widespread antibody testing in Napa County. And then I'm wondering whether we are not putting enough focus on containment and being more aggressive in terms of isolating those who have cases and going back several times to those folks to make sure that we are doing adequate tracing. And then once we do the adequate tracing, whether we should be quarantining those folks who have been traced. So those are my 3 areas of concern.
Yeah, why don't I address one at a time? Let me start. Am I supposed to address you now, or do I? Okay.
Yes.
So let me just start first with face coverings. According to the Centers for Disease Control and Prevention and California Department of Public Health, it's recommended that people wear face coverings when they go out in public. And here's the reason why. It's believed that about 1/4 of people with COVID-19 are asymptomatic, but may be shedding virus. So the whole idea of wearing a face covering is it prevents the wearer from transmitting infection to another person. Especially when they speak, cough, or sneeze. So the face covering contains any secretions, and then it prevents infection of other people. So it's really not to protect the wearer, but it's to prevent the wearer from transmitting infection. So I think the question you have is about cloth masks. Those are recommended, and in fact, the CDC has put out guidance on how to make your own, and you can either sew them or else you can do a non-sewing option, like making it out of bandanas or t-shirts. And I think part B of your question was about the distribution. Your concerns are that they're distributed in a way that is not safe, or I just wanted to clarify that.
Go ahead, Mr. Doring.
Yeah, I'm clicking off the mute again. Yes. Yes, exactly. Is it contradictory to have people distributing masks to other people and also complying with physical distancing protocols?
Well, I think there's a way to distribute masks and still comply with physical distancing protocols. It's much like, if somebody delivers food, you can practice physical distancing as well. I think the thing I would advise is if you're, getting these masks from other people, you could be as an abundance of caution, you might want to wash the mask before you wear it. So that's something I would recommend. And of course, frequent hand washing after handling a mask that's given by someone else. But I think it's a good thing to, and I want to say face coverings, because when we say masks, I think about disposable masks, which really need to go to our healthcare providers. Second, antibody testing. I think that right now we don't have the capacity to do antibody testing. That takes drawing blood. A lot of my nurses don't do that. So I think that that's something where we'd have to, partner with our healthcare partners to see if that's something that would be of interest. The only lab right now that's doing systemic antibody testing is Stanford. So there's a lot of logistics of making sure that those blood samples get to that lab. But our public health lab does not have the capacity to do that at this time. And then the third part is isolation and quarantine. So I'm curious because we are issuing isolation and quarantine orders, isolation to cases, quarantine orders to contacts. But we issue it to high-risk contacts. So these are really household contacts. The people that are medium-risk contacts, they actually are contacted by our health department every day and we have symptom screening, but they're not issued quarantine orders for medium and low-risk contacts, according to CDC guidance.
Thank you, Dr. Relucio. I know we have limited time with you. Are there any more council questions? Priya, are we seeing anything from the public?
Right now, Mayor Ellsworth, I am not seeing anyone from the public raise their hand in the meeting. Thank you.
Okay, very good. Dr. Relucio, I'd like to thank you very much for being here with us and getting us up to date. Thank you.
Thank you, Doctor. Appreciate your comments.
Thank you. Thank you for having me. Okay.
Thank you.
Okay.
Oh, okay, very good. So we will now move on to an update from Dr. Steve Herber from Adventist Health, St. Helena Hospital. Dr. Herber, are you with us?
I am. Can you hear me?
Thank you very much. Yes, thank you for being here.
Great. Well, when I received this invitation, I wanted to share with you about our preparedness and give you a little hospital update. And if there are things that you'd like to know about that I forget to mention, I'm happy to answer any questions at the end of this. But first to preparedness. So you may not know this, but we have 150 licensed beds at Adventist Health St. Helena. And we have a surge plan to be able to care for almost 190 patients. That's a very generous size institution for the territory we serve here in the Upper Napa Valley. So we've got lots of space and have a detailed plan of how to segregate normal things we care for in the community. People are still going to have appendicitis and things. So we would segregate infected patients if and when they come. We still have not had a patient in this hospital that is tested positive for COVID. And we've had a number who've come to us from outside the area that had risk factors and symptoms, but we've tested them all and nobody has been positive. So we're still waiting for our first case here in St. Helena. So we have plan to have up to 39 ICU patients if that were necessary. And remember, the reasons that you'd be admitted to the hospital if you had a COVID infection is needing oxygen, or in worst cases, you might need mechanical ventilation. So we have a lot of capacity. We have elaborate preparedness plans. Every day, our incident command is working on our supply of masks and personal protective equipment. And so I think we're in good shape to meet a challenge should it arise. This community is so supportive and generous. We have established a resilience fund, and we have people contributing to that from as far away. Yesterday, we received a gift from Germany, somebody who had a family member cared for here. Some people in Texas made a generous gift. And so with that, we are supplementing some of our supplies. So our foundation leader is not needing to go with the hospital system supply chain, and he's finding thermometers and a variety of personal protective equipment through other means. And so that's really supplementing what we have. We're looking at acquiring some very cutting edge technology to keep the hospital. We're doing a lot of disinfection and terminal cleans, but in addition, there's some new technology that makes the hospital even safer. And we're going to use some of the funds to provide that for the hospital. Again, I've shared with the community the message that it's safe to come here if you need care. And I think people are really taking seriously the shelter in place, and they're apprehensive. And so I'm not seeing the normal routine things come into our emergency department and to the hospital that we normally see. Other safety steps we've taken, in case you aren't aware, we are now following a masking protocol for all our visitors, and all of our staff are wearing masks every day, and we have enough in our supply chain to be able to do that. So the masks that you see medical personnel wear, we are doing that on a daily basis. We're not routinely having visitors join patients in the hospital. There need to be special circumstances, end of life issues and other things, but we're trying to reduce the number of people coming into the hospital so we keep it safe. And many of our staff that aren't frontline clinical caregivers are working remotely. We've been optimizing virtual visits also for safety. So our cancer center is trying to do as many of their visits with patients who may have immune suppression because they're under cancer care. So those are happening virtually through telemedicine, and we're really increasing our capability in our ambulatory clinics and hope to do half of our visits virtually. There's some things you just need to see the doctor for, but we're trying to keep people safe and at home. Testing capability. So we've really been constrained because the county had limited resources, and then we also have used Quest. So starting this week, we now have in-house testing. Dr. Relucio mentioned that. So we're going to be testing patients in the hospital and providers. We have some providers that get exposed to COVID, and we want to make sure they're safe to be caring for other patients. So we'll use our capabilities for that and then supplement what the county's doing. So we'll use their protocol. So if somebody's referred for testing in St. Helena, they might be able to come here and get it done, but the county is organizing that. And then I want to expand a little bit on what Dr. Relucio mentioned about virtual hospitalization. So as there's a surge and really sick people need to be in the hospital, there is a way to safely care for patients at home that might need hospitalization. And our system, Adventist Health, is working very closely with the governor's office to develop this capability. And our hospital, because we're kind of in a rural area without a lot of COVID patients, we are setting up a virtual hospital here where we're going to support patients elsewhere in the state because the hospitals are full of infected patients. And so we're going to be providing care through virtual hospitalization. And we were the first site in our system to be selected for that work. I think those were the main things that I wanted to share with you on updates of the hospital, the preparedness front, and I'd be happy to answer any questions that any of you have.
Thank you, Dr. Herber. I see Anna. Are you, yes.
Yes, thank you, Mayor Ellsworth. Hi, this is Anna Shuto. Thank you, Dr. Herber, for being here.
Of course.
I'm curious, how many ventilators do you have, and will they be sent outside of our community at any point?
No, that's a great question. Some of our sister hospitals have shared resources. We are not planning to send anything outside. We have the capability right now of having 19 ventilated patients, and we have just received a donation of 6 more ventilators that are on their way to us. So we'll have a total of 25.
Thank you.
Thank you. Are there other questions from the council?
I have a few questions, if you don't mind.
Yes, Mr. Doring.
Just want to know about your ICU staff and whether they are trained in intubation.
Yes, the ICU staff, we have a dedicated intensivist team of doctors, and we also have a full set of anesthetists who regularly intubate patients. And while we're doing, we are rescheduling elective surgery. So we have a whole team of cardiac certified anesthesiologists and nurse anesthetists. So we have probably 12 people who all are trained in intubations along with our ICU team. So we are overstaffed in that department.
Good. That's good news.
Yes.
Dr. Lucio mentioned, and maybe you answered this, but I didn't catch it, but you mentioned an alternative site here locally. Talk a little bit about that.
No, I'm glad you brought that up. So the all the healthcare organizations in the county have participated in thinking about what we would do for less sick patients if we needed more beds outside the hospital. So in Napa, the Napa Valley Expo has been considered a site. I have reached out to Dr. Bob Cushman, the president of PUC, and they have that. For any of you who've been to Angwin, they have that very large gymnasium, and they are readily making that available. So if you think of what happened in the Javits Center in New York, and the Corps of Engineers set up a number of hospital beds, that site has been offered if it were needed.
I assume that St. Helena Hospital would be prepared to take any overload from other Napa County hospitals, including the Queen of the Valley?
Yes. So we expect that there will be other patients that we're serving. I just don't anticipate this Upper Napa Valley having a surge that would need our whole capacity.
Mm-hmm.
I actually had the leader of the Kaiser hospitals in Solano County, the large one in Vacaville and Vallejo, ask if we would have any capacity if they were overwhelmed. So we are prepared to serve not only our community, but a broader community if there's a pressing need.
One last question. This is curious, but of course you study these issues and studying them more now than you probably did in the past. But I'm curious about the modeling. What model did your organization or did you use to determine that 39 ICU beds would be sufficient for a potential medical surge?
Yeah.
Or overload of other existing hospitals?
What we did was we identified spaces where we could create the right environment to make it safest to care for those patients. And so it was kind of limited by our facility. We think that far exceeds what the surge would be. But the modeling is a mathematical modeling that Dr. Relucio's office has gotten that's used in the state that's trying to anticipate the number and the and when it will occur. And so I firmly believe that in St. Helena, and I live in town and I see this on a daily basis as our friends and neighbors are out and about or not out and about. I think we've taken the social distancing and all the guidance seriously. And I'm hopeful that we've really suppressed the surge and bent that curve. And so I'm quite optimistic about our community, but we will see as time goes on. It's just eerie to have a hospital that's so empty and ready for patients and nobody's showing up. So I'm hopeful that the Upper Napa Valley is very fortunate in this pandemic, but we're prepared for whatever happens.
Thank you, Dr. Herber. I appreciate your comments.
Thank you, Doctor. Are there any other questions from council? Okay, seeing none, I'm going to open this up to public comment.
Mayor, I think
So,
Mr. Knudsen has a question.
Sorry, I've raised my virtual hand. Do you see this?
All right.
Here's my
now.
virtual hand. Do you see that? I can also wave at you. Doctor, thanks so much for participating today. You know, we're all in this together. It sounds like you're working closely with the county and the county health officer. Of course, we don't have a city health officer. Is there anything that you need from the city of St. Helena? If you don't need anything now, is there a possibility of needing something in the future? And do you feel like we've got those links so that we're set up to help you?
Great question. And I have to say, I appreciate the mayor reached out early on, wanted to establish a connection, line of communication, kind of hear about our preparedness. I think we have a great connection. We feel like working with the public health system and also with our system being connected with the governor's office, we're in pretty good shape. And just this community is supportive. We have restaurants sending meals for our staff and others. So I feel like we're very supported, and yet there's, if you all feel like there's something you're apprehensive about and want to know, we're open for immediate connection. But I don't feel like we need anything more than just knowing that you're aware of us and keeping posted. And I think we're going to be fine. I'm cautiously optimistic.
Thank you.
Thank you, Doctor. Is there any other? Are there any other questions or comments from the council at this point? Okay, seeing none, I'm going to open it for public comment. Priya, do we have any comment that's come in?
Mayor Ellsworth, I am looking right now, and it appears that there is no comment from the public for this item.
Okay, very good. So I'll bring it back to the council. And with no further questions, I am going to thank Dr. Herbert very much for being here. It means a lot to us in the community to know that you're there doing what you do. So we appreciate it. Okay, so with that, we will move on now to a discussion with Priya Nixon about how public participation will be received in these virtual meetings going forward. Priya, are you there?
Yes, good evening, Mayor Ellsworth and members of the council. As Mayor Ellsworth said, my name is Priya Nixon, and I'm here just to give you a quick overview of how you can participate in our council meetings. So I just want to give a quick overview. So you can watch our meetings on Channel 28. You can also participate by joining Zoom. And we're really encouraging people who are joining by Zoom, who have access to a computer, to sign in and download the Zoom app. If you don't have access to a computer and you'd like to call in, you can also do that. Our city clerk has very conveniently located the link to join Zoom on the actual agenda. So you can find that on the agenda at the very top. I want to talk a little bit about public engagement and public comment. So there are two ways that you can do that. The first way, we're recommending that anyone, when the agenda is published, can email like they normally would to a new email address, publiccomment@cityofsthelena.org. Again, this is also listed on the agenda. And you have up until 1 hour before the meeting to do that. So we're really encouraging, as we navigate doing these meetings virtually, to use that email address. We've also set up in the Zoom meeting a way to give public comment live. So you can do that by joining the Zoom meeting as an attendee using that link, or calling in, and you're able to follow the instructions, and you can raise your hand. And then when the mayor calls for public comment, we'll be able to see who would like to speak on that issue. So that's just an overview. Again, all of this information is located on the agenda. Thank you so much.
Thank you very much. Are there questions from council on this protocol here? And seeing none, thank you, Priya. And we'll move forward with that. And I'm sure as we go, everybody will be getting a clearer understanding. So thank you. We'll now move on to our regular, it's the special meeting. And the public comment part of this, under California law, public comments at special meetings are limited to subjects on the agenda only. Therefore, public comment will take place during consideration of the item, and each person's comments shall be limited to 4 minutes. And using our new protocol, we have a few ways for people to make those comments. So we'll move now to item 4.2, and this is our city manager COVID-19 emergency update, and this will be Mr. Prestwich.
Thank you, Mayor. Just want to provide an overview of various activities and procedures that the city has implemented in response to this emergency. And you may be familiar with a lot of this, and it will be a fairly broad overview, and we're happy to answer questions after this. The city has established a virtual emergency operations center. We call that an EOC. It's intended to manage the emergency. The county has also stood up their EOC, and each of our EOCs have 4 sections: a planning section, a logistics section, an operations section, and a finance section. Our sections are supported by a 3-person team of public information officers led by our city clerk, Cindy Shapopoulos. And I want to thank them and all of our staff for the terrific work that they're doing with this virtual EOC. Our team is actively communicating via city e-news, social media platforms, and they continue to curate a up-to-date website, cityofsthelena.org/coronavirus, with COVID-19 resources, a variety of resources. Our EOC staff meet daily to review our evolving incident objectives and to coordinate our emergency response. As you probably know, the city closed its library and discontinued recreational services about 2 weeks ago. This was in response to the county public health order that required the city to discontinue non-essential determined services, and as a result, those 2 departments were reduced. The closure of these departments also reduces the potential transmission of COVID-19. Similarly, the city has closed most of its parks with the exception of Wapo Park. This is the dog park, and we have transitioned that park and now require the dogs to be on leash. We've opened the 2 gates that people access the park, so the dogs would run out if they weren't on leash. And we've also closed the picnic area to reduce these high touch areas in an effort, again, to reduce the potential transmission of the virus. At the staff level, we have provided direction on cost containment efforts. So we have suspended any non-essential purchasing or spending. We've suspended travel, and we've eliminated overtime. We continue to assess our financial impacts, and now the staff is preparing a report that we will present at the April 14th council meeting that will provide preliminary estimates of the city financial revenue impacts associated with this COVID pandemic. We do expect that these are going to have a substantial impact on our hotel and sales tax revenues. We anticipate publishing that report Thursday or Friday of this week. We've taken additional steps to reduce the potential for transmission among our city staff. We've reduced the number of staff at City Hall. A number of staff are teleworking from home. We do have a skeleton staff structure at the City Hall facility. We have adjusted and isolated shifts, bedrooms, apparatus, and break rooms at our fire station to assist our first responders in reducing the potential of transmission. We have adjusted our work hours at our Public Works field courtyard, both the starting times that they start each day for our 3 divisions, as well as lunch and break times. And finally, we've enhanced cleaning protocols with city buildings and city vehicles. We've had a number of questions related to police services, and at this time, I also want to invite our police chief, Chris Hartley, to provide an update on all things police related.
Good afternoon, Mayor Ellsworth and council members. Some of the added protections and procedures that we've put into place to deal with the COVID-19 is, one, we've worked very closely with the county. I meet with them 3 or more times a week to consolidate efforts. As far as our officers are going, the county is providing all safety that they can by ensuring that officers, when responding to calls, are not walking into an infected situation without knowing better. We've implemented decontamination of vehicles, patrol vehicles before and after each shift, face covering whenever an officer leaves the department and goes outside. And they're using the N95 masks whenever they're knowingly going to contact a citizen or go into a public building. They're also wearing gloves while they're out and about. Each vehicle has a package that contains Tyvek suit, spare N95 masks, and gloves, so that at any point during a shift they can don this stuff if needed. The department itself, inside the department, we're decontaminating and wiping everything down twice a day, once during the day shift and once during the night shift. The citizen lobby has hand sanitizer and all PPE that may be needed for anybody that comes in to visit the police department. We're not encouraging people to come. However, if they need to make a payment or they need to pick up an application or a form, everything is readily available inside the citizen lobby without having to bring them inside. Recent activity due to the coronavirus is, with everybody being quarantined or self-quarantined, there's been a spike in vehicle burglaries. So I can't emphasize enough, now more than ever, making sure that your vehicles are locked when you go in the house, and do not leave your keys inside the vehicle. We had one vehicle stolen where the keys were left inside. Gasoline thefts goes along with the vehicle burglaries. This past Saturday night, I'm sure you're aware of, we had a horrific hoax played on a family on Madrona Avenue, and it taxed both our police department and all the local agencies who also responded. Fortunately, nobody was hurt. Everybody was safe. And we're currently working with the FBI, and we have a very good lead. And the police department, we have had nobody ill or felt the need to be tested. We're moving along the best that we can. Are there any questions?
Thank you, Chief. Any questions from council? Mr. Knudsen.
Yeah, let me unmute myself. Thank you very much, Chief. I had sent you an email earlier about this, but I think maybe it's useful for the entire city, just for a public record perspective, just talking about how we may have folks heading through town that we wouldn't expect to see normally, perhaps sleeping rough or camping. And I just, I'm encouraged that the police are aware of that and are going to be providing sort of greater check-in around downtown and the few businesses that are open to ensure that, that we are, sort of kept safe from a public safety perspective. So I want to thank the police for that effort. And then also just, we've all noticed, those of us that have been out and about, that people are driving much more poorly. It's not just about speeding, but it's also about sort of awkward driving maneuvers. And I don't want to encourage the police to make additional stops at this time, but I'm hoping that we can get the message out to be particularly vigilant as you're driving, because drivers around us, if you have to go out, drivers around you may be distracted. Thanks.
Thank you.
Thank you, Mr. Knudsen. Any additional council question?
And we also have other department directors if you have questions for any department manager.
Okay, thank you. Council, any questions at this point? Okay, seeing none.
I have a question. I have a lot of questions. Many of them have been answered, so I appreciate that. One particular item that I thought would be prudent to raise at this point is the potential for expediting our downtown sidewalk project, given the lack of disruption going on downtown right now. There is no business downtown. There is no traffic. I know that staff has given some thought about that. I'm wondering what the status of that potential is.
Vice Mayor Doreen, thank you for raising that. I think that it's a terrific idea to consider ways that we might accelerate the project because of the emergency. The emergency has turned off a number of businesses downtown, at least the brick and mortar, which means there are fewer pedestrians on the street, fewer cars in the right of way that would be needed to close for the deployment of that project. It's in the relatively near the end of its design stages, and we have had some conversations about how that might be interesting to advance or accelerate during the emergency to provide it. Is minimal. Public Works Director, City Engineer Erica Smithies is on and can provide you a general overview of the timeline, perhaps. And it might be appropriate also for us to receive some guidance and feedback on whether this is something that is of broad interest, and we could potentially schedule either a conversation a week from now on the 14th to further answer and dialogue on a couple of remaining policy issues, or a special meeting dedicated solely to this topic.
Thank you.
So
I think Mary has a question or a comment.
Yeah, I would like to have a meeting on this issue when you feel you have information to bring to us that can actually help us make a decision. Like, it's a good time to expedite this because the businesses are closed. I'm curious, will the length of the project still be as long? Do we have the same scope? Just general things that would normally come to mind. And I'd be happy to talk about it next week if you're ready to talk about it. But given the plan that had gone into place to try to help the businesses while they were in operation, it's a wonderful plan, but if we can get them through a lot of this while they're closed, that would be even better, I think.
I think we're in a position, and I'm looking to Erica a little bit, but I think we're in a position where we could provide you an update a week from today and schedule a discussion with the council on what the steps are that remain to obtaining the permits, timeline issues, as well as I think an overview of remaining policy issues that we need feedback on directly from the council.
So that could be on our meeting on the 14th, a discussion. I think that sounds like
yes.
the timing. The time good. Okay, good. Any other thoughts on that?
Councilmember Knudsen has a question.
Mr. Knudsen?
Sorry, I was trying to unmute. Sorry about that. We'll have to figure out this virtual hand, actual hand, et cetera, in the future. One thing that for our next meeting I'd also like to discuss is sort of how do we sort of support the town citizens going forward. First of all, not just through this shelter-in-place situation, but when we come out of it, in terms of the economic impacts, in terms of providing services, the library, parks, and public safety. And I also would love to have a discussion amongst the council about how we support the town's employees to keep them employed so that they can continue to support our town citizens. I almost feel like it's a patriotic duty to keep people employed if one can, and I think we can. And I'd like to talk about some of the decisions that we would make in terms of our surplus and in terms of our various capabilities to manage through what will inevitably be a steep decline in at least sales tax and TOT tax revenues. I'd like to help us understand sort of what our priorities are as a town and how we can also support the employees that are supporting us, because I think it's I don't want to make the mistake of putting our town in a hole in terms of providing both for our employees and for the citizens that they support. I want to make sure that we do that both and think carefully about how we manage through this situation. So perhaps we could agendize that for our next meeting as well. Thanks.
My understanding is that will be part of next week's discussion, talking about some of the economic impacts and how we're going to manage. Is that correct, Mr. Prestwich?
Yes, we're planning a overview of the financial impacts, and I think we can. I think that's the appropriate time for the additional issues to discuss the additional issues that Councilmember Knudsen has raised.
Okay. Are there any other council thoughts before I open this? Oh, I see Ms. Koberstein. Ms. Koberstein, Mr. Doring.
Yeah, I mean, it seems to me this is very closely tied to the budget, which you've probably had to start revising and rethinking considerably. So, I'm happy to have a discussion, but I think that we're going to need the whole sort of picture in front of us, along with the options that you typically would present to us of what's on the table and what has to come off the table. So I'm happy to begin the discussion, but I feel like I really wouldn't have the ability to make a decision until we've sort of seen the whole forecast and what you're recommending.
Just briefly in response to that, I'm anticipating that on the 14th, we provide the council with an update on what we forecast from a revenue impact standpoint. In terms of solutions and options, my recommendation is that conversation would start sometime at the end of the month or in May. So I would anticipate some form of a report on the 28th that follows the meeting of the 14th to begin to outline various options. That will also provide us the advantage of learning more about what conversations are occurring at the state and federal level that may provide some additional relief to the city.
So are we still anticipating the preliminary budget meeting April around, I think it was the middle of May, was when you were originally forecasting it, or is that needs to be pushed back?
The finance director and I have had some conversations about how we might rethink the budget process. I think we may need to start a little earlier and begin to outline options. I'm anticipating a more difficult challenge as we attempt to close a very large number in a very short amount of time. So I would anticipate some early conversations on the meeting of the 28th of April. And then those would mature over time as we evaluate the options and learn more about what assistance may come from the state or the federal government.
Thank you.
Thank you. Mr. Doring, did you have a question?
Yeah, well, Councilmember Koberstein raised a point that I was going to raise, and I appreciate that. I don't think it's good to operate it by piecemeal budgeting. We have to have the whole picture, so that's a good point to raise. I happened to participate on another matter. I happened to participate this morning in an excellent webinar by our law firm, BB&K, on leveraging FEMA and CDBG block grants. It was an excellent presentation. I hope some of our staff were able to watch that. If not, there's another one, a follow-up on April 22nd. I think there are slides available. Of course, it is our own law firm that put on an excellent production. There are a number of landmines, but there are a number of opportunities that we need to start focusing in on. And I know we have, we could get started earlier. I have notes to share with anyone. Hopefully somebody watched that, because there were a lot of excellent advice. A lot of the excellent advice was given to start that process early, to document everything we can think of. I guess I have a question on overtime. I'm not sure if we want to necessarily eliminate overtime if we can get compensated for overtime. Can you talk about that issue, Mark? And talk about the issue of FEMA and reimbursement and who is tasked with that and how that's going?
Okay, so briefly, in our finance section of our EOC, that finance section is led by April Mitz. It's supported by Deputy Mandy Kellogg, who has a lot of experience with FEMA reimbursement through floods, fires, issues like that, attempting to track reimbursement efforts through PSPS events. We've been very successful because we have done a very good job of documenting expenditures in years past. And the additional benefit is we have some past practices where we have staffed up with overtime, for example, with fire and the fire department, and been reimbursed for those costs. If the overtime is emergency related, we have no trouble with that type of essential service. It's the non-essential overtime that we've discontinued. If it's something related to maintenance in a city park, we wouldn't expect to be performing overtime duties related to that unless the staff member had to perform some duty because it was related to the emergency. People were using a trail more, and there were 10 trash cans along that trail, and we needed to remove the trash on a regular basis. That would be something that would be eligible. But I think we have terrific staff that are carefully watching this. We had another meeting today to talk about additional forms that need to be documented to monitor the activities of our emergency operations center. And we have supplemented the staffing with an additional person to support Mandy and April to ensure that more eyes are on the documentation side, because that's going to be the key to the future conversation about eligibility of expenses. I'll pause there and ask if April would have anything else to add.
Did anyone in the city participate in the webinar on FEMA leveraging?
I don't know if anyone from finance did. I did not.
I would highly recommend that somebody access that from our attorney, that webinar if they can, and the slides. I think that the information is really important. I think it's a whole new ball game. I appreciate the experience from past disasters, but there are a lot of changes and a lot of opportunities, especially if we start now getting our act together. We could be making a 50% request pretty quickly. They call it a worksheet. We can be getting online and starting our account right now. We need to be talking to our vendors in terms of how they identify anybody who's doing work for us that's related to COVID. We need to have them submit bills that specifically identify that. We need to specifically identify that, looking at our stock, our supplies, and what we're using that's COVID related and not. There's just a whole series of things that we can be doing, and I'd hate to lose the opportunity to get reimbursed for all of that. Labor, stock, dealing with vendors.
I assure you that we are on top of that, and maybe April can speak to some of the examples of some of the outreach we've already done with vendors, as well as documentation and coordination with the state.
Yes, thank you. Yes, we have reached out to several of our vendors, and now whenever they invoice us for anything COVID related, they are specifically noting that on the invoice. Right. In addition, from the day that we declared the local emergency, we set up a special accounting code that's specifically just for COVID-19 related items. So we're designating those specifically. Mandy is working with Erica as well on any of the public works tasks on anything that's COVID related. They are being tracked on the ICS 214 forms as well as on our own timesheets. So several of the items that you had mentioned, we actually have already started the process beginning the first day that we declared the local emergency. In addition, Mandy has been in contact with Cal OES, so it's our regular representatives, and we've talked to them. They've reached out to us, and so we're discussing the different options as far as reimbursement. And they're the normal channels that we go through with. Basically, we'll present them with the paperwork and ask them for any suggestions as well.
Great. It sounds like we're on top of it. How about the potential revision of our CBDG block grant application to adjust that to focus in on this crisis that we're in right now? Has anyone given thought to that? If not, we should give some thought to that.
Not that I'm aware of, but I'll make a note of that.
Thank you.
Thank you, Mr. Doring. Is there any other council comment or question before I open it to the public?
I have one question.
Yes, Chateau.
How does COVID-19 and what we're going through right now impact some of our bigger projects, like the City Hall and the Reimagine St. Helena project and the dam project and the wastewater treatment?
I'll take a stab at that one. In terms of some of our larger key projects, we are moving forward on those. We, if anything, we're focused on trying to accelerate those and make sure we don't miss deadlines. And so York Creek Dam is an example of that. The streetscape is something that we think could be potentially accelerated. In terms of City Hall, the task force, the infrastructure financing task force has, we have canceled 2 meetings. We do anticipate bringing them back. I know there's work happening behind the scenes, and it's my understanding that they have their report approximately 3/4 drafted. It will eventually go back to the task force for additional discussion and review before it's submitted to the city. So I would expect that perhaps we've had maybe upwards of about a 30-day delay associated with the work of the task force, but that was directly related to this particular emergency. And I'll pause there and ask if Erica or others would like to discuss additional projects.
I just want to say the York Creek Dam is still moving forward. The agencies have been very responsive to our consultants. We're wrapping up some critical cultural and archaeological work, but those were submitted today that are part of our permit applications. We still intend to go out to bid, hopefully here in a week. That's the goal. So an application, I just saw an encroachment permit application for the county come across my email while we're on this meeting. So things are happening. Water treatment plant, that's moving forward. I don't think the RFP's out for environmental, but those 2 big projects are, I mean, there's nothing stopping those right now, trying to get those fast tracked. And in addition to that, we've staffed our EOC in a way that frees up a little bit of Erica's time. So Clayton is our operations section chief in terms of our field operations. That preserves some of Erica's time to keep moving forward on some of these very key public works related projects.
Thank you.
Thank you. Any other questions from council at this point? And I'm not seeing, I'm just going to check and see. I'm still trying to figure out how the hand raising goes, but I'm seeing none. So I am going to open it to public comment, and I'll ask Priya if we've received any public comment.
Thank you, Mayor Ellsworth. I'm looking right now to see if anyone is raising their hand, and I am not seeing that there are any hands raised for public comment related to this item. Thank you.
Very good. Okay, well, I'll bring it back to the council. If there are no other comments or questions, we will move on to item 4.3. Okay, so that is 4.3 is consideration and approval of a resolution authorizing paid administrative leave to city employees under certain conditions during the COVID-19 outbreak. And this is prepared by April Mitz, our finance director.
Great. Thank you, Mayor Ellsworth and council members. So this particular staff report is consideration and approval of a resolution authorizing some paid administrative leave to city employees under certain conditions. This came about as part of the local state of emergency. The city has taken steps to scale back on city operations and also recognizes that certain employees have been impacted by the reduction of services and have been required to take leave from work for reduction in workload, as Mark indicated earlier, for the closure of the library and recreation, and or to be at home to care for a child under the age of 18 whose school or daycare was canceled. So as a result of this, the city is recommending that the city provide paid COVID-19 administrative leave from the day city employees were sent home or otherwise instructed not to report to work due to the shelter at home order. And that would be effective March 20th through March 31st. And April 1st is when the federal act actually goes into place. So that's why we limited the dates from the 20th to the 31st. The recommended COVID-19 administrative leave will allow up to 80 hours for full-time staff and up to 40 hours of part-time staff. And in the report, it lists the 5 reasons that would qualify for the use of this leave. So if its employees are sent home or instructed not to report to duty due to lack of work or who are unable to work remotely. The second is for employees who are sent home because they're demonstrating symptoms of COVID-19. The third is for employees who have been diagnosed with COVID-19, are subject to a mandatory quarantine, ordered due to exposure to the virus, or who are at home due to being considered high risk due to age or medical condition. The fourth reason is employees who need to care for an ill family member or dependent that's tested positive for COVID-19. And then the final reason is for employees who are unable to care for, or who are unable to work because they do have to care for a child under the age of 18 whose school district or child care has closed down due to the pandemic. So employees who have taken leave for the conditions listed above have been using other leave balances available to them. And if this resolution is adopted, the employee leave balances will be adjusted accordingly. Today, I ran the full impact of what this looks like for the city. Currently, we have 5 full-time staff members and 16 part-time staff members that would benefit from this policy. It's for a total of 475 hours. 204 of the hours are for full-time staff, and then 271 are for part-time staff. And the estimated fiscal impact is approximately $12,700. So based on the report, we are recommending that the council adopt this paid administrative leave, and I'd be happy to answer any questions.
Thank you. So my understanding is this is to cover a gap that exists that the federal guidelines stepped in at a certain date. Is that correct?
That is correct. The Federal Leave Act went into effect on April 1st. So this is to cover that March 20th to March 31st gap.
Okay. Are there any comments, questions from council? I've seen Ms. Koberstein. Ms. Koberstein?
Sorry, had to unmute. I originally had some questions about this policy because I was confused and thought it applied to a wide range of city employees, but my understanding is that we're talking about a minimal number of employees between March 20th and 31st. And it was a case where they really couldn't work even though they wanted, although one had the childcare issue. I support this. I think that going forward, we really need to know, and I hope we'll learn soon, whether and to what extent the federal policy will really cover us fully or if it won't. But I think that the provision in this resolution that going forward requires people who are actually really sick or, taking other time off to use that available time first before they start taking up the administrative leave time. And my last question, which I could not remember, is how many personal administrative days are employees entitled to generally?
As for personal administrative days, are you talking about personal time off, PTO, or executive leave?
I'm talking about what I would call a personal holiday, not being sick and not being on vacation. I believe there are like a number of personal days or something that employees can also take.
It ranges from 3 to 5 depending on the number of years of service with the city.
Okay. And so going forward right now, the major issue is with the people who essentially are considered non-essential services. Correct?
Yes, the non-essential services, and then we did have at least 3 employees who had to stay home to take care of a child under the age of 18.
Okay.
If I could just interject really briefly, this is Kara. The federal law that went into effect on April 1st does cover basically most of the people who were covered in this policy. If you go down the list in the resolution, there are 5 different categories labeled A through E. So the federal leave, either through the emergency paid sick leave or the new expanded family FMLA leave does cover categories B, C, D, and E, primarily those people who are sick, who are at home demonstrating symptoms, who are looking for a diagnosis, caring for a person who is ill, or caring for children because childcare is not available. The federal policy does not, though, cover employees in that group that's listed under A, which is the group I think that Councilmember Koberstein was just talking about, those employees who have been sent home and cannot work either at the city or remotely.
I had sort of a follow-up question. Is it clear? I couldn't tell from the federal document that was attached. There were footnotes on it. It talked about qualified public employers. Your understanding is that we are a qualified public employer for 4 of the 5 options, and we somehow get reimbursed by not having to pay payroll tax or something like that? Is that how this works?
Yeah, my understanding is that the city does have to require this federal leave. However, at the moment, I don't believe there's any reimbursement that is going to be provided. I think there's an effort on the part of some cities and local governments to try to get additional funding from the federal government to get that leave paid for, but at the moment it's not. It's required that we provide it, but not necessarily. There's no money at the moment behind it. That could change, but that's my understanding as of right now.
Okay, so April has some COVID number that goes with all of these payments as they're going out. So if we can ever get money back, we would be able to do so.
And in addition to those leave holidays that Ms. Mitz was describing, our mid managers and executive staff have between 40 and 80 hours of administrative leave annually.
Okay. Any other thoughts, questions from council? Okay.
Just one suggestion with respect to the resolution. I think it would be helpful to actually point to the federal act in the resolution. I don't think it's really mentioned anywhere in the resolution, and the whereases, it would be a good whereas. Unless I missed it, I stand corrected if I did.
No, the resolution does not reference it. We actually drafted it before the federal law went into effect, or had a name even. So we could add something in very easily.
That sounds like that's something that can be done.
That's a really good idea. I'd be supportive.
Thank you.
Okay. With that, seeing no other council questions, I'm going to open it to public comment. I'm going to ask Priya if we have any public comment coming in on this item.
Mayor Ellsworth, I am looking right now, and I am not seeing any public comment. Thank you.
Okay, so with that, I'll close public comment. I'll bring it back to the council for any further comment or question, and barring that, I would entertain a motion on the resolution.
Well, I would move we approve the resolution with the amendment that Member Doring mentioned to specifically reference the federal act.
Second.
And a roll call, please.
Councilmember Koberstein?
Yes.
Vice Mayor Doring?
Yes.
Councilmember Knudsen?
Yes.
Chateau?
Yes.
Mayor Ellsworth?
Yes. So with that, that is our final item, and that will lead us to the adjournment of today's meeting, and we will see back next week for a meeting. And on the city website, it says stay home, stop the spread, save lives. So encouraging everybody to continue with the shelter at home, the social distancing, and staying calm and positive as we work forward. So thank you all very much.
It's nice to see you all.
Good to see you.